In December of 2021, I came down with COVID. My whole family did. And in fact, all of them, my son and my husband both got really sick, had high fevers, and then recovered. I didn't really get that sick. I didn't have a fever. I didn't have too many strong symptoms, but mine would devolve into something a little bit more devious. I created this journal called my Long COVID Journal to kind of express to myself and to others what my experience was with long COVID. But there are so many different stories around the world of people who have experienced different tales of long COVID, some who are still struggling. And my whole thought of sharing this is that in the hopes it would help somebody else feel not so alone and not so isolated, and also to educate people on what long COVID could look like. My husband gave me this sketchbook, and with it, it's just a watercolor book. I started using pen and ink. So December 2021 was when I got sick, and I created this sketchbook in October of 2023. It was a pen and ink sketchbook of my experience with long COVID. So it started, my COVID test was on December 22nd, 2021. And on the 24th, I got a call that my COVID test was positive. And this was back in the day when they would put it all the way up into your nasal cavity quite far. So, chicken dinner for Christmas on that holiday, unfortunately. So, December 2021, Christmas was pretty low key around our house. For about a week, my symptoms included gastro issues and heartburn. And then in January 2022, the headaches, oh, the headaches. And I wrote that because I've never experienced anything like this. I've had migraines in the past, but this wasn't a migraine. This was so much more. It was pounding pain. And just like a migraine, it was sensitive to light and sound. But unlike a migraine, nothing would relieve it, not even opioids that my doctor had given me. The pain intensified in March 2022 with a new symptom, tinnitus. So, a really loud ringing in my ear that wouldn't stop at all. There was cramping, there was agony, there was pain. It was just so much to bear. I literally would just lay in bed in a dark space. But I still would take my son to school every now and then when I could. He was still in high school. And finally, at the end of March in 2022, an MRI revealed that my brain was sagging into my spinal column due to a CSF leak. And that's a spontaneous CSF leak. CSF, that's the fluid in your brain and the dura that protects your spinal column. And it's what helps lubricate your brain, and your brain floats in it. Mine was almost completely gone, and they couldn't find the hole as to where that leak occurred. Now, some people have had spontaneous CSF leaks before from things like Ehlers-Danlos syndrome, and new my neurologist suspected that possibly I could have had an undiagnosed case of Ehlers-Danlos. Some people also have had CSF leaks, very rare, but it has happened with that test for COVID going up into the nasal cavity on the wrong angle and piercing the dura there. My doctor thinks that's unlikely because they would have seen a large amount of fluid coming out of the nose, but I did have a runny nose, so it is possible, but we are still not sure and we will never know for sure. A blind blood patch was scheduled for the end of April 2022. And my doctor told me to get home immediately. I was driving my son home from school at the time, and stay on flat bed rest for the next month. With a CSF leak as severe as mine, there is a high risk of stroke. So they just wanted me to stay flat and only get up to use the restroom. My little miniature pincher, Ollie, was in bed with me, never left my side day or night. He could definitely tell something was wrong. So, over that next month of bed rest or so, while I was waiting for that, I started knitting. I could do it in dim light. I had learned to knit as a child, and it occupied my hands, but also my mind. And because I couldn't watch television and have that light, I could barely listen to an audiobook really lightly, and I could knit. And it just really saved my bacon in terms of being able to be creative, do something productive, and keep my mind off of my troubles. After the blood patch, my pain slowly receded. My neurologist had me stay on bed rest for a week longer and to build my strength slowly. Now, the blood patch is a magical thing. They hook you up to a ultrasound machine, put an IV in your hand, and pull blood from your hand and inject it using that ultrasound machine right into your spinal column. The blood then goes into the vacuum of your spinal column and finds the hole wherever it might be and clots over that hole and patches it. And then over time, your CSF leak is gone and the fluid actually repopulates in your spinal column and your brain. Then once that was finally taken care of and I could get up and move around a little bit, I started finding that I could not breathe while attempting the simplest of tasks. So I would be walking from my bedroom to the living room and I was panting and out of breath. And I went to Costco one day with my husband and fainted on the concrete. And thankfully, I was able to catch myself before I fell, and just kind of prop myself up a little bit. But it happened a few times that I fainted. And so my doctor referred me to a pulmonologist and a cardiologist. I was sure it was my lungs. There was something wrong with my lungs. It affected my talking. When I was showering, I would be out of breath. I couldn't talk on the phone, is what I mean by talking. Even just having a simple conversation would exhaust me and I would be panting and out of breath. Brushing my teeth, trying to concentrate too hard. Standing was too difficult. So I went to the pulmonologist and he said my lungs looked amazing and were of a much younger person. So clearly it wasn't my lungs. So the next step was a cardiologist. And right away, the cardiologist noticed how high my heart rate was and checked my blood pressure, and it was alarmingly low. So he asked me to stand up, and the minute I stood up, my low blood pressure plummeted even lower. So they ordered more tests, and that was in September of 2022. Things took a lot of time. My appointment with the pulmonologist was in August. My cardiologist was in September, with so many people experiencing symptoms of long COVID and just regular cardiology needs and pulmonology needs. Appointments were hard to come by. The results that there was no real damage to my heart at all, but clearly I had POTS. That's postural orthostatic tachycardia syndrome. It's where your heart rate is so low, or sorry, your blood pressure is so low that your heart rate pumps really fast to compensate for that. And again, some bad things can happen with that. I had a heart monitor on me, which confirmed my POTS. So some of the other symptoms that were created around poor executive functioning while all this was going on. So even with my breathlessness and my fainting, there were other things that I was noticing. Really hard time with memory. It was like I couldn't keep track of time. Time wasn't linear all of a sudden, and I'd kind of skip forward and backward. I was having trouble focusing on any one thing and retaining that idea or anything that was going on with an idea. I couldn't organize myself, and I pride myself on organization. Time management became an issue. Vocabulary retrieval was terrible, and I still struggle with that from time to time, where I'll be talking and I can't remember a basic word. Emotional disturbances, so there would be times where I'd just start crying, and that was probably due to depression. And this, more than anything, made it impossible for me to paint and work while I was ill. Not even just the fainting, but the inability to focus on anything, to apply my mind to a concept and hold on to that concept was absolutely impossible. And even though my CSF leak was fixed, and I kind of have some metallics in here, it's hard to see, but I started having daily migraine auras. So I explained before, I've had auras in the past. This is an image of me with my dog sleeping between my legs. And one day I looked down at him and I saw this backwards C shape that was shimmering and vibrating. And it starts really big in my vision and it slowly gets smaller and smaller. And sometimes I don't notice it until I realize I can't see what it is that I'm looking at. It obscures the thing that it's in front of. If I take Tylenol, before it becomes really small or within 20 minutes or so, I will not have the pain of the migraine. I'm lucky that way. Having that aura in advance as my warning mechanism. So I just get that Tylenol in me, and I don't have the pain associated. It still comes with it some fogginess and fatigue on top of the already foggy fatigue I was feeling with my long COVID. So it was pretty disruptive to my life to have daily more migraines. Thankfully, they weren't materializing into pain, but still the kind of hangover that you get with them was present. Then in October of 2022, I finally got to see a doctor with the long COVID clinic at the University of Washington in Harborview, which is in downtown Seattle. And finally, I had some hope. She said I had at least another 9 months, possibly up to 18 months or so, before I'd really see relief. At that time, they were treating symptoms, and I think that right now, when I'm filming this in 2026, that's still largely true. But there are some other medications that can treat multiple symptoms, whereas before, at this point in October 2022, they were throwing things at the wall to see what would really stick, and they found that time was the best healer of all. Honestly, one of the best things I got out of the UW Long COVID clinic was the support group that came with it. It wasn't just a never-ending support group. It was a series of kind of support group classes that were led by a neuropsychologist. And we met weekly for, I'm not even sure, 8 to 12 weeks, where we could relate to each other, and we learned how to cope with our symptoms. And what I really found striking about the long COVID support group, it wasn't about teaching us how to deal with our depression necessarily, although that was a part of it. It wasn't even about, therapeutic remedies or medications people were using. It was about reframing our minds to cope with the fact that our lives may never be the same again. They were really trying to help us adjust to a new lifestyle where we may be disabled forever. That actually was very depressing, but it was also real and it was helpful. Along with my support group was a mountain of medications that, like I said before, there wasn't one, there were many that helped with the worst long COVID symptoms. I had medications for the migraines that they were trying. I had medications to help me stay awake. They were trying something called naltrexone, which is a medication for people who are addicted to alcohol or drugs that they found had helped with long COVID symptoms. Of course, not covered at all by any insurance companies. Physical therapy as well was very helpful because they taught me how to breathe in a whole new way so that I could slow my heart rate and raise my blood oxygen. I didn't realize my blood oxygen level was suffering a little bit because of all of this, but we did a lot with that. And one of the biggest things they did was have me get an Apple Watch. The Garmin watch is another great one, even better than the Apple Watch. But having a watch like that, which I hadn't had before, helped me monitoring my blood oxygen and my heart rate at all times. So if I fainted or I was feeling faint, I could lay down and look at my heart rate and wait until it came up to a certain point. For me, we were waiting for it to go down to 75 beats per minute. And then once I got to that, then I could get up again. And of course, learning to pace myself. That was another big part of the support group, was pacing yourself, because every time you feel like you're doing a little bit better and you do a lot, that long COVID just sets you right back to square one again. So learning to accept that new reality, so very, very, very hard. Every little step forward, there would be 2 steps back, and sometimes 3 or 4 steps back. Every time I get a cold or a flu, even to this day in 2026, it still sets me back a bit, and I get increased POTS symptoms. I get increased issues with my executive functioning, as you just heard. But fatigue can also do that too. So just making sure that I'm doing an appropriate amount of exercise, that I'm not overexerting myself, making sure that I'm getting enough rest and not doing too much is a part of the key. One of the most helpful tools I found for long COVID or any sort of post-viral symptoms that you might have came from the government of British Columbia, Canada. They had a chart that plotted activity levels with an energy equivalent for somebody suffering from long COVID or any post COVID syndrome. So, for example, socializing with six or more people is equivalent to running. Painting is equivalent to walking on a stairmaster. Having a phone conversation is equivalent to doing the laundry. And reading is the equivalent of doing a yoga workout. Knitting itself would be like sunbathing. And that's why knitting was so peaceful and relaxing to me. It was fairly mindless. I didn't have to do any thought, any creative thought myself. I literally just could follow a pattern, and it became very repetitive and calming. So this energy points chart is available. You can just Google it, or I don't know if this link is still active, but it's phsa.ca slash health dash info slash post slash COVID dash, sorry, dash 19 dash care dash recovery. And again, I don't know if that's still active, but you can probably just search for energy points chart and long COVID. So I continued to heal. In January 2023, I had knit all of these items in that previous year. It was restful but productive downtime. So I felt like my mind was engaged. I wasn't hyper focusing on my troubles. I was able to put my energy into something productive. And this is just an image of all of my knitted items, hats and sweaters and scarves and toys. And then I came down with the flu and a strep infection, which took a couple weeks to overcome. And as I said before, it erased all my previous progress. I was right back to square one, except for the CSF leak. I had extreme executive functioning challenges, fainting often, hard to breathe, hard to think. That setback really threw me for a loop, and I descended into my own 10 levels of hell. Depression. I despaired that I'd never fully recover. My fatigue deepened from sleeping 12 hours a night to 14 to 16 all night long, and half of my day was gone to sleep. And the folks who'd been suspicious of long COVID's existence really frustrated me, though some came around, but there were a lot of people who would say, well, what do you really have? Or what does the doctor say that you really have? So talking about it became more taxing than I expected. My fear was that a cure or treatment would never be found and that I would never be able to work again, and this would be my new reality. There was a lot of anger because the world moved on. After COVID, people were frustrated at being inside, and I feared I'd never work again. 18 months in with minimal progress, that setback made my self-worth drop to an all-time low. My parenting and my career were suffering with me, and kind of in silence. The sense of isolation, it's staggering, because especially at that time, nobody really knew much about long COVID. A lot of people were denying it. It became very political, and unfortunately, I was living in the reality, and I felt really alone. Stuck in limbo. And one of the worst parts of being depressed that much is the lack of motivation to even get up and do anything. You just feel adrift. Envy. That was something that made me feel like a horrible friend and spouse, but I envied everybody their good luck, their ability to just move forward and go on with their lives. And people would look at me wearing my mask out and about and not doing much. And to this day, I still, in crowds or at cold and flu season, wear my mask and feel very judged. Depression made me feel so small. I knew I needed help, so thankfully, with the help of my husband, I reached out and I got it. My doctor prescribed some medication, and I started to take more time to reconnect with my feelings and with friends I hadn't talked to in a while, because I had been kind of isolated. It was hard to talk on the phone. It was hard to reach out to people, and I didn't want to just be negative all the time. So talking to your friends can be really challenging when you're in that state. But doing things that I've always loved but hadn't been able to do in some time, I was slowly able to get back into. So October 2023, I started doing this long COVID journal. I had all these images and everything in my mind throughout the illness, and knew that once I got to a place where I could hold on to a thought for a little bit longer, I could finally put together in a book. Acceptance was really the component that I was missing. Even though I was told I would have to accept, it took me longer. I'm a slow processor, clearly. I had to tailor my activity level to benefit my healing, but not overextend me, and that included every part of my life, and as well as allowing myself to rest as much as I needed to. And I still to this day require a lot of rest. And so I have to kind of guard my time and being able to rest when I need to. At the back of my journal, I have a note about being kind. For everyone you meet is fighting a hard battle. That was written by Plato, I believe. And I wrote, I have accepted I may never be at full strength again, but am grateful to have come this far and hopefully farther. And then I wrote, in gratitude to my husband, Ron Stoke, for taking such good care of me. He was literally my caregiver for, I mean, in the long run, this was written in 2023, but actually it was 2.5 years before I was really able to start functioning in a meaningful way again. My mom, Kathy Banderka, for being there whenever I needed her. My son, Gray Hoskins, for helping me laugh at myself and my situation. Kathleen Neely, Sue Robertson, my two good friends who listened to me whenever I needed to vent. Dr. Jeanette Parveen, my primary care physician at Evergreen Hospital. Dr. Laura Goldstein, my neurologist at Evergreen Hospital. Dr. Daniel Hallam, a diagnostic radiologist at the UW. Dr. Jennifer Lee, an anesthesiologist and pain management specialist at the Evergreen Hospital, who did my blood patch. Dr. Vikas Sharotri, my cardiologist, who I still see. Dr. Kendall Sankari, my UW long COVID clinician, who I've just stopped seeing. So that's a good sign. Dr. Joel Peterman with the and I keep saying UW, that's University of Washington Clinical Psychology. He led our support groups. And North Sound Physical Therapy and Work Rehab in Seattle. They did my long COVID physical therapy rehab. Here I am now in 2026, and I feel like I've gotten most of my life back. For the most part, I am working and able to be out in the world the way I once was, but I have a little bit of PTSD around crowds and getting sick again. So whenever I'm around crowds, I just wear my mask. And if you see me wearing my mask, it's not because I'm trying to be antisocial. It's because I'm trying to protect myself. And I still have a little bit of a fear around that. Going back to where I was really frightens me. But otherwise, I hope that if you're suffering with something, whatever it might be, whether it's post-COVID or any long-term illness, that you don't feel alone, and know that there's always help out there. You just have to advocate for yourself, and you have to believe in yourself, and you know what you're going through, even if others don't. My first primary care doctor didn't quite believe that my migraines were anything serious and didn't take it seriously, just prescribed opioids, which did not work anyway. And I finally spoke up for myself and saw a different doctor who immediately took it seriously, and that's when they discovered the spontaneous CSF leak, and thank God they did. And even though I still have some issues with executive functioning and POTS, I feel like they're under control. Right now, the biggest issue I have is with chronic fatigue syndrome, which has come on pretty strong since my post-COVID symptoms started, but there is medication for that too. So just treat yourself kindly and treat others kindly, because you never know what they're going through. And I hope this helped educate you about long COVID.